Welcome back. A year after the World Health Organization declared a global pandemic in response to the COVID-19 outbreak, the world is asking, how have we been impacted? The COVID-19 pandemic really has put some serious physical and mental health consequences for individuals, creating that for groups and societies. Dr. Melanie Ross Mills joins us this morning. She's a temperament therapist. Good morning to you, Dr. Mills.
Hi, thank you for having me.
I'm glad to have you back here too. Now, a recent report titled Stress in America, done by the American Physiological Association, recently shared their results about what's been happening during this pandemic. And what do you think are, I guess, some of the key findings?
Well, what they're finding is there are specific groups and genders and ages of people that are really being affected by COVID-19 pandemic. So we've seen people gain weight. For example, the average person that they studied gained 29 pounds over the last year.
Yeah, sounds about right.
Yes, sleep changes. But what really stuck out to me was the mental health. We've seen a lot of people struggling and wrestling and being diagnosed with mental health disorders.
So when we look at this report again, what are we talking about when it comes to mental health and some of those numbers?
So we all probably know or are essential workers. And what they found was that half of essential workers were diagnosed with mental health disorders.
Wow.
So you guys, that is sobering to me. And it's something that we need to pay attention to because we are all surrounded by people that were essential workers. This is serious, and I'm thankful we're talking about it.
What about when it comes to parents and their children? There was a lot of stress with that as well.
Yes. So this report also found that mothers of young children from 5 to 7 increased their alcohol consumption, but they also were reporting 5 out of 10, for example, had some mental, basically health trauma, so struggles, and were really trying to wrestle through what was going on. That's serious. That's half of your mom friends if we look at a global view of statistics. Yes.
You're absolutely right. Another age group you wanted to focus on was young adults, 18 to 24, Gen Z.
Yes, so 18 to 24, you guys, think about our college age kids that have really been misplaced, displaced, trying to figure things out. Maybe they didn't even get to college. It's been a serious issue that we need to look at and how it's affecting them mentally, and also be sensitive and ask the tough questions, provoke dialogue, encourage transparency, especially with this age group because they're trying to figure it out.
Dr. Mills, when we're talking about dealing with COVID-19 a year later, I guess what are some alerts or how can we possibly prepare for what's to come?
Well, that's what I like about this report is it is showing us that we could really be looking at some prolonged stress, some collective trauma. And I think it's important for us to discuss and have this dialogue so we can continue to shed light on this very serious issue. It's not a fun topic, but you guys, it's real. And if you are struggling with some mental health, just depression or anxiety or fear, please don't hesitate to reach out because you are absolutely not alone. These are staggering statistics.
Dr. Mills, what would you suggest, I guess, to some of your clients that are dealing with some mental health issues, maybe just feel a little bit of anxiety or some stress? What do you recommend?
Do not go through life by yourself. We cannot do it, you guys. We cannot isolate and expect to become healthy. So equip yourself, learn about even just the ways that you're thinking. Like, am I thinking in healthy ways or these unhealthy ways? How are they serving me well? How are they paralyzing me? So reach out to people to understand what your mindsets are, how you're thinking, and also don't go it alone. Do not isolate because you're not going to get healthy that way, you guys. So yes, reach out to professionals and loved ones.
Exactly. Good insight this morning, Dr. Mills. How can someone connect with you before we go?
I'm MelanieRossMills.com. I also love Instagram and connecting in that way at Dr. Melanie R. Mills.
Perfect. Dr. Mills, thank you so much for waking up early and joining us this morning.
Thank you for having me.